Meanwhile, a new coronavirus mutation has apparently been identified by scientists in Cyprus. They say the strain has Omicron-like genetic signatures within Delta genomes and has already been dubbed Deltacron. But some in the scientific community have urged caution, questioning the findings and urging patience. The data has been sent to the official international database where scientists from around the world will get to take a closer look. New strains will continue to appear as the virus circulates around the world, and not all of them should cause concern. Let's find out from Professor Shabir Madhi whether that's correct. Professor, thank you so much for your time. Start off with this variant that's been dubbed Deltacron. The first question is it real? Some experts saying it's the result of a lab contamination.
Peer-reviewed before we can be conclusive. But at the same time, I think you've already mentioned is that we need to become accustomed to the fact that the virus is going to continue mutating. There's going to be further variants that are going to arise, which might be similar to Omicron, or which might actually be more similar to the original virus circulating. The evolution of the virus is almost a given now. Future variants are a given. The big question is, what is the clinical relevance of those future variants? And as we've seen with Omicron, despite what was being painted as a doomsday scenario because of the number of mutations, as it transpired in South Africa, the Omicron wave has been the least severe wave since the start of the pandemic when it comes to hospitalization as well as death. A part of that might be related to the virus characteristics in that it's less able to infect the lower airways. But the other big part of it is we're in a very different stage of the pandemic, where despite only a modest uptake of vaccines in a country such as South Africa, there's extensive amount of immunity against severe disease, protection against severe disease, because of a large percentage of the population that have been infected with the virus during the course of the first 3 waves. So in summary, we should stop getting excited when new variants are described. We need to wait and see what is the clinical relevance of that in a very different phase of the pandemic.
So only time will tell whether Deltacron is a real thing or not. It's been dubbed Deltacron. That's not an official name, but that's what people are calling it. Is that mixing of genomes possible, though, Professor?
Absolutely. You can get mutations which are randomly a consequence or result from mutations of different previous variants, and there's going to be new mutations. So those sort of mutations are possible. I think what the scientists from Cyprus were suggesting is that there was some sort of what we call recombination between the Delta variant and Omicron variant, resulting in evolution of different type of virus. That is possible, but I think unlikely. So we need to have that data peer-reviewed. But again, important to emphasize is that what's critical here is the clinical relevance of this mutation. The mutations itself are not important. It's the clinical relevance, what those eventually mean when it comes to people being infected with the virus and when it comes to people developing severe disease and dying, compared to what had happened in the past.
So even if a recombinant variant were to occur, there's no telling whether it would be more or less lethal. It could be either or?
Absolutely. And I think in the South African context where we've got substantial amount of immunity, and there's another arm of the immune system other than antibody, which is known as T-cell immunity, which seems to be much more important in protecting against severe disease and death. Despite the type of mutations that are taking place, particularly in the spike protein, that arm of the immune system is relatively conserved, and consequently people are still protected against severe disease, even though vaccines as well as past infections might work less well in preventing reinfections or breakthrough infections. So again, important, we just need to be circumspect with the type of data that comes forward. Because we need to become accustomed to new variants being reported, but we shouldn't reflexively become over-concerned. We need to be circumspect.
Prof, you've mentioned quite a few times the high level of immunity in South Africa. I mentioned just before you got on that there's about 45% of the adult population that's been vaccinated. So with the high level of immunity, is that 45% number still a concern, or should that not be the focus anymore?
It's absolutely still a concern, and I think we need to be clear. In South Africa, is about 15% of people that have received at least 2 doses of vaccine. A single dose of J&J vaccine does not constitute fully vaccination by any stretch of the imagination in any other country in the world. So we should stop overstating the number of people that are fully vaccinated, firstly. But it still remains a concern because even though we've got a large percentage of the population developing protection against severe disease, there's still about a third of the population that probably don't have that protection against severe disease. And the biggest concern is not the children that are going to school needing to be vaccinated. The biggest concern remains that even now, we only got about 55% of people above the age of 50 vaccinated, and that figure needs to go to 90%. If we can get 90% of people above the age of 50 vaccinated, then we start breathing a sigh of relief in this country, because the chances of even a future variant resulting in large numbers of hospitalization and deaths drops tremendously. And the sort of focus needs to be about who is being vaccinated rather than simply the number of doses of vaccine that are being administered.
Prof, if we're trying to get people vaccinated, we've been asking this question for months now. How do we convince more people to get vaccinated, especially in the climate we have right now where there's consistent talk of Omicron being less severe? It seems as if people are now quite lax about going to get a vaccine because there's the belief that we're moving from a pandemic to an endemic.
Sure. So Omicron, we need to be clear, Omicron might be less severe, but probably not. It's probably not less virulent. More important than that is that the reason why we've experienced a less severe outbreak this time in terms of hospitalization and death is because of this buildup of immunity. So people are in a different stage of the pandemic. Like I mentioned, a substantial percentage of the population have got immunity against severe disease. But at the same time, when we look at the number of the people that are dying, ending up in ICU, which places stress on our healthcare systems, the vast majority of them, 75 to 85% of them, are unvaccinated. So it still tells us that people need to be vaccinated. What does government need to do? I think government has come short when it comes to advocacy, when it comes to communication. It's been trying to turn the corner on that. But at the end of the day, it's really up to South Africans to take on that challenge of making sure that they and their colleagues and their family members get vaccinated. And again, to emphasize, particularly if they're above the age of 50 or if they've got underlying medical conditions that predispose to severe disease. These vaccines are not working too well, unfortunately, in protecting against infections and mild disease due to COVID. They might still be able to reduce transmission, but they work tremendously well when it comes to protecting against severe disease and death. So we need to get those people, 90% of those above the age of 50 vaccinated. And everyone in society has got a role to play in terms of encouraging others to be vaccinated if they have not yet been vaccinated, and to ensure that they've received 2 or 3 doses of vaccine, depending on who they are.
Prof, thank you so much for your time, and thank you for always being generous with your time. We appreciate it. Professor of Vaccinology, Shabir Madhi.